In patients who have experienced an ACL tear, the patient will present with an intracapsular bleeding resulting in edema around the joint. The athlete will be limited into extension as a result of the swelling and muscle guarding of the hamstrings in an attempt to protect against anterior translation of the tibia. In addition, the athlete will have extreme pain into flexion from the capsular edema. Flexion and extension must be regained prior to surgery. The athlete should have full extension to 0 degrees and flexion in a range of 120 to 130 degrees. As a result of the capsular swelling, there will be inhibition of the vastus medialis muscle, which will lead to atrophy over time. First order of prehab is to gain full extension and begin performing quad sets to reactivate the VMO. After surgery, this muscle will be inhibited from the swelling and atrophy quickly, so it is important to increase muscle activation and muscle strength before the procedure, so the decline of the muscle performance will be less. Before surgery, it is also important to work on hamstring strength for 2 reasons. First, to make sure the athlete is maintaining a 3:2 quad to hamstring ratio. Second is to use the pull of the hamstrings to prevent the anterior translation of the tibia, a task usually performed by the ACL. During the procedure, it is important to monitor the incision for any signs of infection, which will present like the picture shown here. These will include any redness, hot to touch, increased pain, streaks running towards the heart, or any pus around the area of the incision. Initially, the athlete should avoid flexion because of the stress it will put on the incision. Once the scarring has run its course, the athlete should then begin to aggressively increase flexion. The patient should work on VMO activation in the first week, followed by performing quad sets 5 to 7 times a day. During this time, the athlete should also focus on beginning hip strengthening exercises in order to increase stabilization once the athlete begins weight-bearing exercises. Once the athlete regains full extension, they can start performing weight shifts to begin weight-bearing on repaired leg. By the end of the first week, the athlete should be able to passively reach full extension and begin working on weight-bearing exercises as the first functional milestone of the rehab.